happens when the parasite is in the blood. When the parasite is in the blood. So this eliminates the parasite from the blood. This treatment is called clinical treatment. But in Plasmodium vivax, we are encounter with a problem. What is that? Relapse. Can you remember?
Yes.
Do you remember?
Yes.
Relapse.
4 months or 4 years.
Yes. Clinical treatment does not affect on the relapse. What should be done? We use another treatment. When we finish the third treatment, administer the last treatment of chloroquine, we start the first treatment. We say week number 1, first week, with what? 0.75 milligram per kilogram, another drug. This drug is called primaquine. Primaquine, the first time, after finish the last dosage of the blood treatment or clinical treatment of Plasmodium vivax, we start the first dosage, first time treatment of relapse, anti-relapse. We carry on this treatment until 8 weeks. Each week, one time. Each week, just one time. Finished here, the clinical treatment starts the relapse treatment every week until 8 weeks. So week 1, week 2, 3 until week 8, just one time each week. Primaquine. This treatment is called anti-relapse. Both of them, anti-relapse, clinical treatment in Plasmodium vivax is called radical treatment. Radical treatment. If I ask in the exam, which of these multiple choice is radical treatment? For example, this. You say most of them means clinical treatment, and anti-relapse is radical treatment. Okay? So this treatment is at the moment currently in the world in those areas that we have got malaria, vivax malaria. This treatment is used. For future, God knows. I don't know. What about the Plasmodium oval or ovale? As the same as Plasmodium vivax. Because we have got relapse in Plasmodium oval as the same as. What about the Plasmodium malariae? As the same as the Plasmodium vivax, except anti-relapse. Why? Because there is no relapse. What about the Plasmodium knowledge? As the same as Plasmodium vivax, except relapse, because there is no relapse. But what about the Plasmodium falciparum, the malignant form of the malaria infection? Unfortunately, the Plasmodium falciparum has got resistance against most of the antimalarial drugs. Unfortunately, just one line of drug at the moment is used against the Plasmodium falciparum. After resistance, what should be done? What is that? Resistance. The scientists are trying to find new line of the treatment. Plasmodium falciparum. The first day, day 0, there are, oh yes, an introduction. In Plasmodium falciparum, monotherapy, monotreatment is illegal. What does mean monotherapy? Using one drug is not illegal. Should be combination therapy, 2 or more drugs together. Okay? There is very sharp drug against the Plasmodium falciparum is called artesunate. Another one, fansidar. At the day 0, we administrate 4 milligram per kilogram artesunate, 25 milligram per kilogram fansidar. Fansidar is 2 drugs as well. What are these? Pyrimethamine and sulfadoxine. Okay, so just focus on the fansidar. Don't worry about these. Fansidar means these 2. Fansidar just enough for us in the exam. Don't worry about those. The day number 1, and day 1 means second day. Again 4 milligram per kilogram artesunate. Fansidar, no. The last day, 3rd day, is called day 2. Again 4 milligram per kilogram artesunate. Fansidar, no. Artesunate is cerebral drug. Cerebral is very important. WHO says go through the cerebral medications in those areas that malaria is spread. So this is at the moment very effective against the falciparum malaria, this combination therapy. And there is no any resistance at the moment here. I did not hear about that. Okay. Next item that before diagnosing, I am going to give you some words about that is this. What about the immunity of malaria within those patients that they have got malaria before? For example, if we get some infections for the first time, we are immune against those for the next time, for the 3rd time. Is it possible for malaria? Means if I get 1 time or 2nd time malaria, my body becomes immune against the malaria. No, unfortunately. I can get different time because of different antigenic differences and changing. So what? If I get one time or 2 times malaria, in 3 times or after that, I do not get complication, even infancy. Okay? So, immunity, permanent immunity that forever we cannot have in the malaria infection. Just there are one kind of immunity. This immunity is called premonition immunity. Premonition in malaria. Premonition immunity. What does it mean? It means as long as we are living in the malarious area and we are exposed by infected mosquito intervally, we do not get malaria. Is it possible? Yes. If we got for the first time malaria, we get antibody, right? And this antibody is in the protective level for the first time, suppose. And I'm in the area that malaria is endemic here, and there I am exposed by the biting of mosquito intervally every 2 hours, every 2 months, 3 months. Entering sporozoite inside of my body makes my immunity update. So I do not get malaria. But if I go outside of this area in non-endemic and I stay there for 1 year and come back in this area, I get again. In this area, I get again. So there is no permanent immunity. Temporary, yes. Premonition, yes. But permanent, no. You cannot immunity in malaria. Somebody do not get malaria. Some bodies do not get malaria. Who are they? Those have got thalassemia. They do not get malaria. If get malaria, very, very low level of malaria, not danger. Those individuals that have got sickle cell anemia, those individuals that have got G6PD deficiency, Favism, you know? And those patients that have got Duffy blood negative, they are Duffy blood negative. Duffy blood negative. These people mostly are living in the African countries. Duffy is a factor in their blood. Some of them are not this factor, so they do not get Plasmodium vivax. But they can get other species of malaria parasites. Right, let's move on the diagnosis. The moment I see, is there anything you know about that or not? I go through the diagnosing. Yes, I covered all items that you need about the malaria that are useful for you, because there are different items, but some of them are not useful for you. They are very specific for parasitology students. Right, let's move on the diagnosing of malaria parasites. All of my lectures are here. 1, 2, 3, 4, 5, and 6. Don't worry about that. All of those I told you here are here. Okay, diagnosing of malaria, because this afternoon, 1 o'clock,
Yes.
you will go through the diagnosing malaria. If we want to diagnose the malaria parasite, we should get some slides from the peripheral blood, from the finger. It's very easy. We clean the finger, the middle finger, or the next one with the alcohol, and we apply stripe, lancet, and we see the first drop of the blood. We clean the first drop of the blood, and we make from the others our slides. Here, cleaning the finger, apply the straw lancet here. After cleaning the first drop, we are going to make the slides. 3 drops for the thick slides. So we have got 2 kinds of slides: thick form and thick form. Why? Thick form for diagnosing the plasmodium, because thick form has got 15 to 20 layers of RBCs. So thick and thin. It smells. Or feel. Don't worry about the smell or feel. Thick smell, thin smell. Thick feel, thin. Thick smell is for diagnosing the germs. What does mean germs? Plasmodium. Because you have got 15 to 20 layers of RBCs, thick. Thin is useful, good for the species. Plasmodium falciparum, Plasmodium ovale. Why? In thick film, you wash the smell and you lose the shape of the RBC. You see just the parasite. But you can find this is Plasmodium, but which kind, which species? You refer on the thin film. In thin film, you say all shape of the RBC and parasite is inside RBC, and the morphology of parasite is clear. You can find the species of the parasite based on the morphology. That I will tell you what are these morphologies that separate each of others. Right? Is it clear for you?
Yes.
So smears, thick and thin. For thick smears, we need 3 drops, as you see here. For thin, we need 1 drop. First of all, we make the thin film, because one drop will go to be dry, and then second one thick, thin, thick, thin, thick, thin, thick. We write down here the number of patients, the date of the time of making the slide and so on. Maybe name of the patient here. Thick, thin, very good, thick, very good, thin. We put these slides to dry, and then we stain them, and after to dry, 1, 2, after dry, we stain them with the cane saw. Don't worry, because you are medical students, you are not laboratory students, so we stain them. After staining it, this is microscope. You have seen. Yes, we are going to, after staining and drying, we put the slide under the microscope. Now we are going to examine. To examine the slide. Is there any malaria parasite or not? First of all, we should differentiate between the white blood cells and red blood cells, because parasites are inside of which of them? Red blood cells. If you cannot differentiate between white blood cells and red blood cells, you will confuse between them. So these are white blood cells. 1, 2, 3, 4. These are red blood cells. Okay? Now let's move on the parasite. The first parasite is Plasmodium falciparum. Plasmodium falciparum. This is ring stage, ring stage, ring stage, ring stage. In Plasmodium falciparum, may you find 2 or 3, maybe more than 3 parasites in one RBC. Here 5, 1, 2, 3, 4, 5. Here 1, here 1. Okay? So this is ring stage. This is growing stage. Growing stage means bigger than ring stage. This is old stage. Old stage means finish the growing of the parasite inside of the RBC, then it starts to be divided, reproductive form. At the first time, 2 or 3 divisions. This form is called immature schizome. When parasite is going under the division form, means going under the schizome form. Firstly, firstly, 2 divisions, 3 divisions. This is called immature schizome. Then mature schizome. Mature schizome finish the reproductive form. And these are the gametocytes that are useful for the mosquito, for the sexual multiplication. The gametocytes of the Plasmodium falciparum is very clearer than others. Why? Because others are just rounded form. But falciparum is banana shape. Very easy. If we put in example this one under the microscope, you say definitely this is Plasmodium falciparum because the gametocyte is banana shape. Others gametocyte is rounded form, as you will see. Okay? This is Plasmodium what? Plasmodium vivax. Bigger than falciparum, because attached to the younger RBCs. Younger RBC is the biggest RBC in the blood. Young RBC is the biggest. You see, this is the ring 4, this is the ring, and old one, immature schizon, gametocytes, rounded gametocytes, you see here. These spots are called these spots are called stippling. Stippling stipplings appear so on the surface of the RBC. On the surface, there are two types of spots. Stipplings and pigments. Pigments appear as a result of digesting parasite from the hemoglobin. Where are the parasites? Inside of the RBC. They are growing. All growing creatures needs food. What is the available food inside of the RBC? Hemoglobin. There is no except hemoglobin any food there for the parasite. Parasite digests, but excretes. What excretion is called pigment. So if I ask you in the exam, what is the pigment you say as a result of digesting parasite from the hemoglobin? I told you all of the questions in the exam. So, the result of digesting parasite from the hemoglobin inside of the RBC is called pigments. But stipplings on the surface of the RBC. Pigment on the inside of the RBC on the parasite. Okay. This is the Plasmodium malariae. The characteristic form of Plasmodium malariae is what is that? Is the bandy form of trophozoa. Look, triangle, rectangular form here, band form here. So rectangular form, band form, and of trophozoite. Rectangular form of trophozoite, band form of trophozoite, and rosette form of the schizon. These are merozoites around in the center pigments. I told you what are the pigments. And gametocytes. Last one is this Plasmodium ovale, ovarian form like this, is very clear. The face of the parasite, this is the parasite, inside of the RBC makes RBC ovarian form. The parasite makes RBC ovarian form and fish eyes form. Fish eyes or bird eyes. Fish eyes or bird eyes. And ovarian form. Gametocyte is rounded for here. Okay? Alright. These are the artifacts in there. You can see the artifact. Artifact means they are not parasite, but the shape is like the parasite. But we do not put under the microscope for you the artifacts. Okay, this is the real sample from the blood of the patient. This is the Plasmodium vivax trophozoite. See here, these are RBCs, all of them RBCs. These are platelet. This is the RBCs, white blood cell, and this is the trophozoite.
Is it thin smear?
Pardon?
Is it thin smear?
Yes, smell. All of them is the real smell. It's the smell of the blood. This is the white piece, RBC, white blood cell. This is the parasite, growing tryphozoite of Plasmodium vivax, because the RBC is bigger than others. You see here? This is the Plasmodium falciparum ring stage. Yeah, yes. What is this? I'm sure you know.
Banana shape.
Gametocyte of Plasmodium falciparum. Why? Banana shape. Yes. This is the real smell from the blood, from the patient. This is the gametocyte macro female gametocyte of the Plasmodium vivax. You see, gametocyte. Here, gametocyte of the Plasmodium falciparum, but male gametocyte because the nucleus is central and bigger. This is Plasmodium falciparum as well as gametocyte. This is the Plasmodium malariae, rectangular form of the shape. Yes, yes. Again, schizoid of Plasmodium vivax, Plasmodium malariae schizoid, rosette form, like this, like this. Thank you very much. Have a nice time. At 1 o'clock afternoon, after your lunch, I hope to see you.